Good afternoon, and welcome again to another episode of cultural competence and how it affects certain field. And today we are going to talk about a very important topic: cross-cultural issues with medical field patient providers care. What I was doing my research, general research on US population, and I found this topic extremely important because it is projected by year 2030, 2035 that US population will consist of 50% of minorities. That means they're coming from different background. And that is so significant because America, the United States, is becoming it is very diverse right now, but it will become extremely diverse. And with that diversity comes different people, different ideas, different belief system, different values. And as a healthcare provider, it is our job, not a healthcare provider, but I believe in as a healthcare provider, it is your job to cater to these minorities. And it is a big responsibility because it will affect everything. Um, and I think there's no better person to discuss this than a physician. So I welcome Dr. Puja Aggarwal. Did I pronounce it correct? First of all, tell me how you would like to be addressed.
You can just call me Puja, and yeah, my last name is Aggarwal. Yeah,
Aggarwal. So I did fine.
mm-hmm.
Okay, well, welcome. Why don't you go ahead and introduce yourself and tell us what you do?
Okay, so I am a neurologist or a physician. Currently practice in Orlando as a neurologist, and so I've been practicing almost 11, 12 years now as an attending or after residency. And besides that, I am also a life coach, and I help female physicians and female professionals overcome burnout. And so I thought that this topic was very important, cross-cultural competency. One being I'm a minority physician, and so I have a different background. My parents are from India. They were born and raised there, and then they came here, over 4 decades ago. So I was born and raised here. So I have a different background. And so coming into medicine, there is definitely a need for being more aware of people's culture and how it affects their treatment plan and what they need out of a doctor or, whoever, nurse practitioner or physician assistant, whoever they see as their care provider. And I think it's a great topic to cover.
Absolutely. And how do you balance out the coaching for healthcare staff, and what do you see in there? They're overwhelmed, they're burnout. How do you do that between what you do and that?
Yeah, so I see patients. I work with the health system, and then but I also do coaching. It's just something I recently started in the last few months, actually. And so from what I'm seeing overall is that female physicians and just care providers in the hospital, nurses, practitioners, physician assistants are overwhelmed, especially with the pandemic. Over the last 18 months, we've had to, we have had many patients we have to take care of. Sometimes we're covering, 30, 40 patients. And then there has been a lot of issues in terms of people dying from COVID, and that adding to in terms of like it affecting the physicians, nurses, and things like that. And so that has contributed to one, having more responsibilities as a physician, having to do a lot more than they were in the past, take care of more patients, and then also having to deal with the trauma of seeing patients die from COVID and take care of them and seeing them intubated. And a lot of people in healthcare have also had family members affected from COVID. So in addition to seeing patients have that, a lot of their family has been affected.
Wow. I am sure it is stressful. I'm sure at a time it can be traumatic, and your role as both physician and coach is extremely needed. And I'm sure that you will help a lot of people. So let's get into the details of the topic. I have a quote from Stephen Covey that said, "We don't see the world as it is, but we see it as we are, and as we are conditioned to see it. So each culture has a set of beliefs that affect everything a patient sees around them, including their healthcare. What can you tell us about, and you can state your personal experiences on how have you been treated if, like, for example, we chatted briefly and you mentioned something about your pregnancy and about delivering a baby and all of that. Talk to us about your own experience as far as what Stephen Covey said.
Yeah, so my experience as, let's say, talk as a patient. So
Yeah.
when I had my first child, I basically gave birth, and literally within like 30 minutes to an hour, as far as I remember, but it was really quickly right after I gave birth, I was asked to like walk, and I had had an epidural. And so, I mean, I was like numb, but they still wanted me to walk. And there's two people picking me up out of bed. They're like, oh no, you have to walk. You have to get to another room. I'm like, look, I just gave birth. Why are you rushing me? And typically, in my culture, once a female gives birth, they're actually like told to relax, not to get up and do things,
Uh-huh.
and to like kind of sometimes pamper, not always, but I mean, it's a lot more relaxing. They're saying, don't do too much. We'll take care of
Yeah.
it. I mean, it's different healthcare system here, and I
Huh?
think that's one thing that we should be maybe more open to. Not even just physicians and nurses, but even as healthcare systems, to be able to get more information about a person, their culture, and what is it that they need? What is it that you can do to incorporate them into the treatment plan so that they feel like they're heard and that they feel comfortable as patients? And I can tell you that when I was rushed and I had to get up and walk, when I just had an epidural and I was numb in my legs, that was
Uh-huh.
like, I say, a horrible experience. And like, I was like, even to this day, it's just something I remember, and it's something I just wish never happened. But just to be able to be rushed to have to move to another room because of that, so I can't believe it. But
Well, I can definitely relate because I will add to that. And same thing happened to me when I had given birth to my first child. I was given ice water, and in my culture, we don't give anything cold to a woman that just gave birth because obviously the preference always goes to breastfeeding, and with that, within a cultural context, is that you have to have something really warm for a long period of time. So as soon as I was given the water, ice water, I said, my mom, who was me, is just, what's wrong with these people? Are they crazy? They don't know that you cannot give that to a lady that just gave birth. That's going to really have an effect on your breastfeeding and so on and so forth. So not only was it a two-edged sword because they did not know the culture, and perhaps I did not tell them, or that was supposed to be conversed right at the beginning during the pregnancy and how I want to be treated. And that happens a lot with a lot of people and a lot of cultures. And the other thing was that when I was treated by or seen by a female doctor all throughout the 9 months. And all of a sudden, at delivery, I am all surrounded by these males that I don't know who they are. And I felt really, I was upset and also felt felt awkward that my doctor, who was a female that was seeing me all this time, was not there, was not available. In so many cultures, obviously, especially in the Muslim culture or Muslim countries, a lot of time women do not want to be treated by a male, or if there is a male treating them, they have to be accompanied by a male relative, is not necessarily the husband or the father, but someone male figure with them. Now, with that being said, a lot of times when I speak with physicians, they said, well, um, we don't have to understand your culture, but interpreter and translator will be fine. What can you say? Is a translator and interpreter, are they enough?
well, I think that that's what we have available as physicians in order to help bridge that communication gap, because obviously we as physicians don't speak all the languages. And so I think that interpreter can help. I think sometimes things are lost in translation. So I think, going from one language to another, things are lost. Yeah. And, it is difficult on both parts. I think the patient's and the physician's part to figure out a way to fully to gather more information besides using the interpreter. I mean, that's one thing. The other thing is just we as physicians can be more open to hearing via the interpreter if that's the only way we can do it. To gather more information about what it is the patient needs in terms of their culture. And we can do our best. Sometimes there is the issue that we as physicians have time constraints. We're saying you need to see a certain amount of patients a day by health system. You need to only get 15 minutes or 30 minutes to see a patient. And some of those things are barriers. And I think we can try to do more in terms of listening to the patient and gathering what it is that they need and incorporate them into the treatment plan. But again, sometimes that is difficult.
Absolutely. And a lot of times, like as a physician, I'm sure you're seeing a lot of people from different backgrounds. Have you ever seen something that you perhaps did not understand or not aware of? Like let's give you an example. In some of the Asian cultures, and I know your parents are from India, probably that's not a practice in India, but a lot of Asian countries, they do acupuncture, coining, cupping, and all of that. And sometimes if you look at the body, you're seeing, oh my gosh, this woman is abused, or she must be abused. Does that happen as far as seeing a patient? And what's the extent of your involvement as a physician when you see situations like this?
So, actually, I haven't really come across that. I know that acupuncture, cupping, and things like that are very prevalent among Asian cultures, but that's not something I've really personally come across. And I think that when we do come across it, we should be asking the patient, what exactly is this from? And they may tell you or be open about it. And in terms of if there is a concern for something like abuse, it really depends on who it is. Obviously, if it's like a child or an elderly, you have some reporting. You have to report that as a physician. You have a duty to report that. If it's like other people, adults, then you have to ask them, what exactly is this from, if it is abuse, and then you have to, if they want to, you can give them information how to report it, but it really has to come from the adult or the patient at that point, unless it's like a child, a minor, or an elderly person.
So the minor, when you have a situation like this with a minor, do you automatically have to report, or you have to talk to parents?
No, you have to automatically report no matter what if you have a suspicion for it.
Wow, I didn't know that.
Anybody 18 and under, if there's a suspicion of child abuse, you have to report it to the state authorities and local.
Wow, that's interesting, regardless of the culture or the circumstances or anything. That's interesting.
Yeah.
And also on other cases, for example, reporting terminal illnesses to patients. Do you consider cultural factors when you report terminal illnesses?
I think that there's a hard balance between it's hard to balance, what it is culturally that a patient or what they want, and then also in terms of our healthcare system. In general, it is a big push of medicine to let people know about, if they have a terminal illness, or if, and sometimes physicians or healthcare pushes to let their family members know about it. And, but it really has to come down to the patient, what it is that they want. Do they want to tell family members? Do they not? And what is that they want, and try to respect that.
Because in several cultures, when you have a reporting, like for example, there was a woman that who had a cancer, and doctors, they told her right up front, and she was quiet, and physicians thought, okay, well, that's normal reaction, because obviously she's hearing really, really bad news, and she was under shock. And the following day, her family came with her, and they were outraged. And that was their mother. They were outraged because they said, how dare you? And this is a physician friend that told me that, how dare you say anything to her, to our mother? Because in our culture, there is a designated person in the family, respected members of the family, that gets called to discuss that with them before they tell the patient. So what you're saying is obviously you discuss that directly with the patient, not how is the culture deals with situation of illnesses like these.
Yeah, I think in general in medicine, we in the US are very patient centered in terms of like that they should know, they have a right to know, and that we should tell them. And it's hard to, I think, to balance that with the cultural aspect, because we don't know as physicians fully the way it works with different people and different cultures. And then how do we balance that with then also letting the patient know that there is a terminal illness or diagnosis, or whatever it may be. So I think it's hard to do that. I'm not saying it can't be done, but I think it is it can be difficult, because we're like, well, we just found this out, we should be honest and let the patient know. And then so we can try to find out more, try to see with the patient, what exactly do you do in terms of how exactly do you get people to give you medical information, and in terms of your doctors and things like that. But it's not very common.
Not very common. And then there comes HEPA regulations, I guess, and all that.
Yeah. So the other thing is with HIPAA, I mean, we can't just go and tell a family member unless like they're designated and said that this is where all the information should go, or the patient doesn't want to know. That's different. But with HIPAA, we can't just share medical information with whoever. It has to be the patient.
Okay. Would you say this just came to mind because, for example, in Sweden, when we go to the doctor, for example, last time I went to a physician, they had me fill out a paper and labels. Are you African American, white, Hispanic, and all of that? And I don't think that is really what should be asked when it comes to medicine. Probably like in Sweden, as an example, they ask you, what is your country of birth? What is your origin? All of that. And that the way they do it, I think is much more effective, because you just share that you cannot know, you don't know. But what if we have some procedures in place that replaces the current system with labeling people? Are you Latino? Are you white? Are you black? Will that be of a help to you right at the get-go? You look and you says, okay, this must have some cultural competence situation, and the platinum rule needs to be applied instead of the golden rule in here. What would you say? I know it's just something that just came up to mind, and I think I always thought it was probably would be more effective.
Yeah, I think it would be more effective when you figure out, if you have the information beforehand, what is their country of birth or origin, maybe getting more information about their culture, what exactly do they do, the norms, things like that would be helpful. I think that's something that we could probably work towards, but I don't know like how quickly. I think that would take a long time to change, because it's not just like physicians, it's like the healthcare systems, because everything is reported in terms of like your race instead of your culture or your country of origin and things like that. It's really race is where you always have to fill out the form when you go to the doctor's office or when you go to the hospital. They ask you those. I think it would be more beneficial to know more information about the background instead of just face.
Very good.
I think it would take a lot to implement it, because we are like very set in our ways.
Now, what do you do? I'm not sure whether this happened to you. What do you do when a patient refuses treatment, refuse your advice, whatever you tell him, this is what you need to be doing? They're like,
Yeah, well, here's the thing. I mean, every patient has a choice to make. What exactly do they want to do? They come to see us for, whatever their medical condition is, and we give them our recommendations or our advice. And in the end, it is up to them. We can give them, all the benefits, the risks of not following the treatment or plan of care, but we have to respect a patient's decision to make that choice, whether they want to follow through or not.
Mm-hmm.
We can't force the treatment on them.
But did that happen to you? Have you ever come across this situation where patients from different backgrounds are refusing your way of doing things, or your recommendation?
Yeah, I mean, I think like most of my patients are not like my same cultural background. And so, yeah, I mean, there's definitely people that don't want to always follow what I recommend in terms of like advice or different things like that. But again, it's just respect what it is that they want to do. If they don't want to follow the plan of care or the recommendations, you can move on. They can either sometimes they may need to find another doctor, or I can try to figure out more information about what is exactly that they're looking for. But sometimes it may be that you may not be the best doctor for that patient. Maybe to refer them out. That can happen, and it's common.
Okay, so cultural competence training versus non. Which one do you prefer? Pros and cons. How do you see the cultural training, the competency of in cultural backgrounds? How important it is in your practice?
I think it's very important to be culturally competent. I think that we should try to figure out the person, who they are, their background, get more information about that,
Mhm.
and try to incorporate that into the treatment plan or plan of care. I do think that we should, in medicine, try to gauge more of like the diversion, equity, inclusion, try to be more aware of other people's cultures and try to, like I said, incorporate that into treatment. And I think, though, there are a lot of limiting factors in medicine. We are not given enough time to see patients. We are not given time to, spend with the patients to figure that all out. And it'd be great if we could move towards spending more time with the patient, not having that, set time, like, oh, you only have this much time to see the patient and you have to see these amount of patients every day. A lot of healthcare systems today is driven by money. I mean, by like doctors, or not doctors, but like hospitals, you have to meet these criteria as physicians. And sometimes we just don't have that opportunity to do that.
Huh. And are there any efforts being made towards that change? I mean, anything
I think,
suggested?
I think that doctors or physicians themselves can definitely make an effort. I think it's harder to do it on a larger scale in terms of like hospitals, health systems. I think there is a lot more initiative right now in terms of like being more aware of other cultures. I still think that it's going to take time. We need to give it more time, and hopefully, in the next, 10 years, maybe we'll be more open to learning about other cultures and incorporating that. But I think it's just going to take time for that to change in the health.
Is there a training in place at where you work at? Is there consistent training in place, or they haven't? They haven't.
Not since I've been there. No.
I'm not. I mean, if you don't want to disclose where you work, it's okay. But you are here in Orlando, right?
Yeah, I am. Yeah, but yeah, not that I've seen. But doesn't mean it's not there. But not that I've seen.
Okay. Well, I know you're busy and you're giving us much of your time. You have to go and see patients. A final thought, Dr. Puja. What can you say? I mean, if we want better health outcome for our patients, for your patients, what do you suggest?
Well, what I would suggest is that we, as a healthcare system, not just physicians, but nurses, nurse practitioners, physician assistant, hospital admin, healthcare admin, all be more about incorporating and being more about a patient's culture or their background and trying to incorporate in terms of their plan of care and their treatment. And I think that could help with health outcomes. When we are more aware of that and trying to incorporate it, then the patient will be more amenable to following what it is that incorporates their belief, and that will, like I said, lead to better health outcomes.
Excellent. I think the doctor, physician, staff, and patient are a team. And within any team, communication is extremely important. Not only how we treat other, but we have to ask how they want to be treated. And the result will be much different if we don't know anything about the person's background, beliefs, and values. And one thing, a last thought that I have is that physicians or non-physicians, anyone that come in contact with anyone different than they are, the first thing to do is evaluate our own beliefs, our own values, our own system as it relates to that person. That's going back again to what Stephen Covey have said. Dr. Puja, thank you so much for your time. And where can people find you if they like to be seen by you or even coached by you?
Yeah, so actually you can go to my website. It's www.zenful, brain.com. and they can actually find my email on there too.
Okay, well, excellent. Thank you so much for your time. I'll let you go and do your work. Have a wonderful day.
Thank you so much for your time.